Well, in this week's Cardiology Countdown, we'll cover pulmonary hypertension, Afib hospitalizations, and a new rapid rule-out MI strategy. So first up is an interesting paper that looks at the long-term outcomes and efficacy of phosphodiesterase 5 inhibition in pulmonary hypertension. This is a study called the FIRST study that had an extension that looked at tadalafil for pulmonary arterial hypertension. And the primary endpoint of the study had been at 16 weeks or 4 months, and this was now a 1-year extension where they documented preservation of the improvements in the 6-minute walk test in patients taking tadalafil at either 20 or 40 milligrams with a slight advantage for the 40 milligram dose. And so I think a very interesting study extending the duration of benefit that's been seen in trials and further establishing this as a standard treatment for pulmonary hypertension. Next up is an interesting paper in AJC from Australia that looks at a 15-year period of hospitalizations and tracking in particular hospitalizations for atrial fibrillation. So between 1993 and 2007, they saw a 3-fold increase in the number of hospitalizations for atrial fibrillation. And this was relative to about a 73% increase in hospitalizations for all other cardiac diseases, and so far outpacing what had been seen overall. Now, interestingly, they saw more hospitalizations in the elderly, and so those who were 80 years and above seemed to have a greater increase in their number of hospitalizations. And so in addition to patients getting older, they're also getting admitted much more often. And so they noted this is really almost an epidemic where we need new strategies, and potentially with the new anticoagulants and approaches that may be possible. And the number 1 pick this week is a 1-hour rule-out MI strategy using high-sensitivity troponins. This is a very nice study done overall about 850 patients where they split a group of chest pain patients presenting to the emergency department into a test set and a validation set, where they looked at use of high-sensitivity troponin that has the very low cut point, both at arrival and 1 hour later, looking at both the absolute values and the relative change. And they have an algorithm that would need to be calculated, but with their calculated algorithm, they had 100% specificity and sensitivity for the overall MI category. And so here they noted actually 97% specificity and 100% sensitivity. So a very nice initial look at the use of change in high sensitivity troponin to pick up those MI patients very rapidly. Now, Kristen Newby wrote a accompanying editorial, and this is the American Heart Journal, pointing out this really needs to be validated in other data sets and look at whether other populations with different pretest probability would have this hold up. It presumably wouldn't hold up as well, but is very promising to try and streamline the throughput in the emergency department to get the real MIs in and the non-MI patients home. So for this week's Cardiology Countdown, I'm Chris Cannon.